Hi everyone, my name is Alice Shi from Wenzhou Medical University. Welcome to the second PBL Medical Talk Show. This video is going to discuss the systemic lupus erythematosus, SLE. While I'm making the PPT and video, the clinical key student and the complete anatomy, these two learning platforms have given me a great help. These two learning platforms have lots of books, images, and videos, and other learning resources, which let me better prepare for this talk show. When I use the clinical key student, I found it's really useful for medical students. Therefore, I immediately recommend it to my friends and classmates. So here we go. This patient is a 27-year-old female, comes to the hospital. She went to the beach for vacation 2 months ago. After sun exposure, she developed a rash on the exposed parts of the face and limbs, without pain and itching. Considering the sun allergy, I gave the topical hormone ointment, and the rash improved after this ointment. However, after stopping the drug, the rash repeated, and there was swelling and pain in the proximal interphalangeal points of both hands, and there was no obvious morning stiffness. Besides, this patient has a history of photosensitivity in the past, and she is newly married and has no child. Then we did some physical examinations. We found vital signs are stable, pale red rash on the cheeks, scattered red maculas on the limbs, and hands were swollen, tender, and unrestricted. Blood and urine routine biochemical results are shown above. Now, given the physical and auxiliary examinations, we have 5 questions to discuss. First of all, what kind of further examinations should you take to diagnose the disease? And then, what disease is diagnosed? The third question is, what are the diagnostic criteria? Fourthly, what are the clinical manifestations so that we can immediately suspect the disease? Last but not least, how should it be treated? Before we answer these questions, let me first describe the systemic lupus erythematosus. SLE is a multi-system autoimmune disease characterized by autoantibody production and immune complex depletion that may lead to organ damage if left untreated. The risk factors for developing SLE are environmental, genetic, and gender or hormonal factors. Who is a typical patient with SLE? The typical patient is a female of age range 15 to 45 years, suggesting that sex hormones influence the probability of developing or expressing SLE. The prevalence is 3 to 4 times higher in non-Caucasian individuals, African American, Asian, and Hispanic. From the table, we can find the female aged 16 to 55 accounted for 65%, and the ratio of female to male is as high as 10 to 15 to 1. After understanding the epidemiology, we next learn about the potential clinical manifestations of SLE. The constitutional manifestations include fatigue, anorexia, weight loss, and so on. The musculoskeletal symptoms are arthritis, myositis, etc. Skin appears as malar rash, discoid rash, etc. And other target organs are renal, cardiovascular, neurologic, pulmonary, hematologic, gastroenterology, and ocular. Due to its multi-system involvement and variable presentation, SLE can be challenging to diagnose and treat. The Systemic Lupus International Collaborating Clinics (SLICC) criteria for classification lists common clinical and immunological findings in patients with SLE and can be used as a guideline for the diagnosis of SLE. The clinical criteria are acute cutaneous lupus, chronic cutaneous lupus, alopecia, oral or nasal ulcers, inflammatory arthritis, synovitis, serositis, renal disease, neurological disease, hemolytic anemia, leukopenia, and thrombocytopenia. The immunological criteria are ANA, anti-dsDNA, anti-SNR positive, anti-phospholipid antibody positive, low complement, and direct Coombs test. A person who satisfies 4 or more criteria, including at least 1 clinical and 1 immunological criterion, is considered to have SLE. What is the histology of the skin rash in SLE? Liquefactive degeneration of the basal layer of the epidermis together with edema at the dermoepidermal junction. Immunofluorescence microscopy shows deposition of immunoglobulin and complement along the dermoepidermal junction. Edema of the dermis accompanied by infiltrates of perivascular mononuclear cells, vasculitis with fibrinode nucleases of the vessels. How would you manage a patient with SLE? There is no known cure for SLE. Modifiable risk factors should be addressed with medicine changes and lifestyle changes, including starting an exercise program and avoiding smoking. All lupus patients should avoid direct sunlight and wear UVA and UVB protection. It is essential to establish the type of SLE and the extent of organ involvement prior to initiating treatment. This is important because prognosis of SLE viruses based on the severity of disease at presentation. Non-steroidal anti-inflammatory drugs, NSAIDs, are used as short-term therapies. Glucocorticoids remain a very effective treatment modality in SLE. Anti-malaria agents are the cornerstone of therapy in SLE. HCQ is the most commonly used agent. AZA, MTX, LEF, and MMF are immunosuppressive agents used in SLE. In organ or life-threatening SLE, the CTX is used. And now, we can go back to the first clinical case. The next check-ups for the patient are immunofluorescence, ANA, complements, C3, C4, anti-dsDNA, anti-Smith, anti-phospholipid antibody, direct Coombs test, random spot urine protein, and renal biopsy. And then we can confirm that the patient is SLE. We advise the patient avoid direct sunlight and wear UVA and UVB protection. Glucocorticoids combined with HCQ were given on drugs. May 10, 2021 is the 18th World Lupus Day. The World Lupus Federation sets the theme of World Lupus Day as Make Lupus Visible. Hope to let the public see, understand lupus, and understand patients. Let patients see, face up to lupus, and understand the correct treatment. Also, let patients see the efforts of doctors, the progress of medicine, see the beautiful future. Hence, let's raise our voices together to fight against the common misunderstandings of lupus and help to provide a better world for the patients suffering from the disease through effective management. That's all. Thank you for your listening.